Good evening, Los Angeles. Thank you for joining me. Each evening we have come together here, you at home and through your TV sets, me here in City Hall, in this incredible room that has contained so much of Los Angeles history. When I became mayor, I looked at photographs of this room, of moments in our history when folks from Chavez Ravine came here to try to petition their government, when great moments and great leaders from Martin Luther King Jr. to others passed through our City Hall. And this place, which is a symbol, not just of this city's aspirations, this beautiful City Hall lit up blue each night, is also the place that has been the center of our efforts to keep you safe and to work around the clock through the weekends and every single day of this crisis. It is here again tonight that we gather, just 2 days before Mother's Day, a day in which we remember those mothers that are no longer with us and celebrate those that still are. Embrace them. Tell them how much we love them and for what they do. And let me start by thanking my mother and telling her how much I love her, and my wife, who's an incredible mother to our child, to our daughter Maya. Throughout this city, it's especially painful because too many of us have been away from our families and our mothers. But I hope this weekend we can all remember just how important those connections that we have between each other are, what a role mothers have played in our lives, and what it means to love, to sacrifice, and to protect those who have made boundless sacrifices for us. There couldn't be a more appropriate holiday in some ways to inspire us and to ground us. As we take careful baby steps forward, today and over this weekend, we are in a new reality, a reality that will require us to each reach for those attributes often. And this weekend we are taking the first small steps into this reality, but I want to remind you that most of our safer at-home order remains in place. We will modify that order in days ahead, hopefully earn each step collectively, but everything else in it remains there and in place. But today, some retail businesses have reopened for curbside pickup today, and I remind everybody, please shop locally. Call or go online, a store that you know and love, and make sure that their business, as they reopen today or in the coming days, is as strong as we can possibly make it. And you'll be able this weekend, of course, to go to golf courses and trails as well. And you can go to coronavirus.lacity.org/saferla to see what changes to the safer at home order are going into effect today and any day in the future. With every action, we cannot forget we are not moving beyond COVID-19. We are just learning to live with it. We're figuring out ways to be safer around this threat that is as great today as it was on the first day that it came here to Los Angeles. To take those steps to get our economy going, but also to stay safe. And each step that we take together will only work if you are committed to making sure that we stay healthy and protected, and that this city is something that we all own together. I know it can be hard to keep up with these changes. As I've said, we're now going from a time of thinking of things in black and white to living in the gray space. But I want to lay out a few things that you can do to prepare. First, remember the foundation of all of this, that you're still safer at home. You still cannot gather with people who live outside your household. So backyard parties and barbecues with friends are not going to be starting up. Instead of visiting your mom in person, if you can, please celebrate safely this weekend. If your mom is alive but vulnerable to COVID-19, just give her a call, and please don't put her at risk. If you are golfing or hiking, you need to wear a face covering. Stay 6 feet away from your fellow players if they do not live with you. And if you're golfing, bring your own clubs. Prepay if you can. If you're visiting a trail, check with the park in advance to be sure you know which areas are open, and bring a backpack to pack up any of your trash. Remember, again, Runyon Canyon will remain closed until we install additional crowd control measures in that always busy park. And on the trails that are open, the best way to keep your distance is to avoid crowded areas. Think about going into other trails maybe that you're not always on, and use hyper-awareness. If someone is passing from behind you, step to the side and let them pass. If you are the one passing, announce your intention out loud to give others the time to move as well. And before you hike or start a round of golf, Communicate your plan to stay safe with the people who you will be with in your household. In the coming weeks and months, we'll announce additional steps to a safer LA that we will take together. And remember that if it's in the best interest of public health and safety, we may sometimes need to hold or even step back. And I encourage you and your loved ones to sign up for the emergency alerts through our city, the way we can best communicate with you the latest news. You can do that at emergency.lacity.org/notifyla. Now, let me tell you about today's data and compare the current data to where we were at this same time last week, as I do each Friday. Today, the county reported 883 new cases, bringing the total to 30,296 cases diagnosed here in the county. This is a 3% increase since yesterday. 1 week ago, there were 1,065 new cases on Friday and a total of 24,215. A week ago, we marked 7,301 new cases for the week. This week, we have added 6,081 cases. Before those numbers overwhelm you, more than 7,000 last week, 6,000 this week, even as we've expanded testing. That's good news. In the city of Los Angeles, there were 310 new cases today, bringing our total to 14,563, a 2% increase since yesterday. A week ago, we added 690 new cases in the city of Los Angeles and had a total of 11,553. Today, we learned, again, like yesterday, of 51 additional deaths countywide in the last 24 hours. That brings our total to 1,468, a 4% increase since yesterday. A week ago, on Friday last, we had 62 new deaths and a total of 1,172. This week was finally less deadly than last week. We added 296 total deaths for this week compared to 324 the week before. But I can't call that good news when 296 people die. It reminds us that every day we're losing souls, people who we love and care about, and for everybody mourning, our hearts go out to you. But it is better to have a lower number this week than last. What we have seen over the last 2 months is the courage of this city, of your efforts to stay home, of washing your hands, of physical distancing, of covering your face, of listening to these addresses, of doing the work so that this isn't something that city halls or our county administration or other cities are doing. This is something all the people of LA are doing together. It is paying off, my friends. When COVID-19, we saw the first cases of community transmission 2 months ago in early March. We were quickly moving towards a rate of transmission that would have overwhelmed our hospitals, but we took action quickly, among the quickest in the nation. In fact, we had some of the earliest orders, whether it was face coverings or whether it was shutting down group gatherings. These things have worked. Now we're seeing a curve stabilize, but it hasn't disappeared. And our new hospitalization rate, which is one of the most important indicators, is also stabilizing, such that we haven't seen more than 200 hospitalizations a day since April 22nd. And today, we had an additional 89 admissions in the last 24 hours, a good number for us to sustain our capacity, but again, not a good number in the sense that there are people still being hospitalized every day. But this tells us that our hospitals, combined with the emergency surge planning that we have done, will allow us to make these slow adjustments and to take these baby steps forward. And we still will have space to treat those that COVID-19 is affecting more deeply and whose lives are being threatened. Across the county, our general emergency hospitals have over 1,000 beds available, 1,078, 875 of which are for acute care, and 203 of those in the ICU units, and an inventory today of 1,146 available ventilators. And as we've continued to ramp up testing, the number of people testing positive is stabilizing in our county around 12% countywide. And I want to say something because while we can't pull the numbers out completely yet, since we have started testing people without symptoms, we know we are finding cases, positive cases, among people who were showing no symptoms. This is really important progress. We can pass those on to the Great County Public Health Department, who then can do the contact tracing of people that those newly diagnosed positive cases have been in touch with, so that this disease won't spread silently, but that we can find as many people as possible. Last week, we had the capacity to test 18,000 people and had tested 165,000 people last Friday through these centers. Today, our capacity is up to 20,000 people a day, and by the end of today, we will have tested more than 250,000 people and met the basic minimum thresholds established by experts across the country and the world for acceptable levels of daily testing to consider the steps forward like the ones we are taking. Anyone can get tested. It is vital to our ability to track and trace the spread of this virus, and it informs our planning in the weeks ahead. So please get a test. Sign up at coronavirus.lacity.org/testing for anybody who feels sick. And even if you don't, these tests are available. We need to find where this virus is everywhere in LA. I've repeated time and again that we will only get through this crisis as one united Los Angeles. That's been true through every step of our response, from our actions to protect public health to our measures to support the people who are hardest hit by the economic effects of COVID-19. And that will continue to be our guiding principles, to save lives and to try to protect livelihoods as we take steps towards a safer LA. And we cannot overstate what the economic impact of COVID-19 has been to our city and our people. Our work to reduce the spread of this virus came with a massive cost. Instantly, small businesses shut down on our main streets. Households lost jobs and hours and income. And by our estimate, our city's unemployment rate has risen from 4.7% in February to over 24% in April. Those aren't just numbers, those are lives and livelihoods. These are our neighbors, and they're hurting, and they need our assistance. We have to help them. We have to continue to come together, whether it's with federal and state and county funds, or whether it's the generosity of individuals like you and foundations and others. We will rebuild, we will recover, and we will reimagine this city. We will do that by uniting business and labor leaders who know their industries and their customers inside out, who understand the shock to our system, and who can help us get this economy going again and create jobs, because they know what it's like on a personal level, on the ground level, to see these things shut down, and they will know what it feels like to get them started up again. It is with their expertise that I am relying as your mayor on figuring out the details of how our steps can be taken safely. With them, we're establishing frameworks that provide guidance on how businesses can stay safe, be economically and financially resilient during and after this crisis, how they can boost their liquidity, boost demand, protect their supplies, strengthen their operations while protecting their people. And that's why tonight I can announce that we have launched a series of working groups across key industries, starting with manufacturing, retail, film and television production, higher education, and cultural institutions. These groups have been well busy for 2 weeks, and every week more industries like hotels and sports and live venues will convene as well. When people ask if this or that can open, I say it depends on 2 things: whether we have the guidance from experts that say yes, and here's how we do it safely, and it depends on you and me, on our behavior and what we do to ensure that guidance is adhered to. When we get both of those right, the rules of the road and the adherence to them, the answer moves closer to yes, it can open. So each of these groups is assembling a toolkit with key health and economic metrics to monitor our progress, along with specific advice on how to gradually expand services, guided by our public health professionals here in Los Angeles, and which we're watching around the country and around the world, to protect customers and staff and operate while under limited capacity. Now, we know that certain parts of our economy, as badly as we want them open, like restaurants, face different challenges than others. a very difficult task for those in which people are close to each other for long periods of time. And for vulnerable populations like our older Angelenos and people with underlying medical conditions, staying home still remains the safest choice. That's why we expanded our senior meal emergency response program with FEMA and state dollars. And since last Monday, we've enrolled 4,774 additional seniors, providing 33,760 meals, reopening 4 hospitality kitchens across our city, putting nearly 120 Angelenos back to work, and having another 126 workers as taxi cab drivers deliver those meals. That's in addition to the first phase of our senior meals program, which, as I mentioned before, scaled up to 12,000 seniors and 120,000 meals per week. And tonight I'm excited to announce that we're partnering with 15 underutilized restaurants in each of the city council districts that span this incredible and beautiful city, who will each prepare and provide meals to more than 1,000 seniors next week alone, building on this program. And I want to thank my friend and a great public servant, Councilmember Paul Krikorian, and the entire City Council for being a part of this effort, helping us select restaurants in need from their communities and backing up their commitment with substantial financial investments. It means more meals for our seniors, it means more help for our businesses, and it means more jobs for our people. And I also want to reiterate my gratitude to everyone who's made this possible. Governor Newsom and his team, Unite Here Local 11, the union that represents so many of our hospitality folks, the Hospitality Training Academy, the Los Angeles County Federation of Labor and Ron Herrera, and the and the taxi cab associations, as well as every restaurant stepping up to help. And to seniors who are listening, who still haven't signed up, if you need a meal delivered to your home, if you're 65 and over or 60 to 64 with underlying medical conditions, please call us at 213-263-5226 or go online to coronavirus.lacity.org/senior meals to enroll right now. Throughout this crisis, I have witnessed the best of the Angeleno spirit, and I know you have seen it all around you as well. Maybe in your household, maybe from you, maybe from a family member or down the block. And thanks to the generosity of so many of you, the Mayor's Fund for Los Angeles will now help 60,000 people with Angeleno cards, but we know that thousands more need assistance. And tonight I can announce the latest major donations to this campaign, and each time we get more donations, whether they're $5 or $5 million, more people get helped. Steve Tisch is a friend who moved here to Los Angeles like so many others to make a life for himself, found great success as a film producer and a business person, and at the same time he's distinguished himself as a pillar of our city's philanthropic community, including tenure as chair of AIDS Project LA. And even though he's the chairman of the New York Giants, he's played an instrumental role in helping to bring the NFL back to Los Angeles. And now I want to thank him because he has stepped up with another extraordinary gift to our city, $500,000 to the Mayor's Fund and to the Angeleno Card effort. And that's not all. I also want to thank the Jonas Brothers for stepping forward to increase the number of people who are receiving these cards by donating $500,000 also to our effort. Combined, these two donations are $1 million more to help Angelenos. So thank you to the Jonas Brothers, to Joe and his wife Sophie, to Nick and his wife Priyanka, who now live in LA, along with Kevin and his wife Danielle, who reside in New Jersey, all showing us LA love. They've long used their platforms and their personal success to do good in this world, and I know you've got a lot of fans here in LA. And I'm grateful to you for not just recognizing the economic impact that this pandemic is having on our families, but for doing something about it. Thanks to everyone's generosity to this fund, lives will be saved. And I encourage everyone to keep on giving and get others to give as well at mayorsfundla.org. Today is the 75th anniversary of VE Day, Victory in Europe Day, when a nation who thought they would never see the light at the end of the tunnel celebrated a victory thought unimaginable just a few years before, when Allied forces closed the curtain on the European theater of World War II, some of the greatest suffering humanity has ever seen. And the greatest generation took a moment to breathe and to celebrate the end of the suffering, of the bloodshed, and to remember those who perished, even as war raged on in the Pacific, where men like my grandfather remained in battle. We're in a very different kind of global fight right now. It's a fight against an invisible enemy on a battlefield that is everywhere, and it's been marked by profound and immeasurable loss. Our tools in this battle aren't tanks and guns, but genes and therapeutics. We're not digging into trenches, but rather posting up in our own homes. And the front lines are now hospitals and supermarkets and laboratories. As assembly lines that once made airplane parts or cars are turning out masks and ventilators. But the way this city is responding has been nothing short of heroic. Our unity of action and purpose is historic, and our struggle will be also long remembered by our children and our children's children. Even with our progress, though, we are still in the thick of it. We need to keep our distance and keep up the fight because COVID-19 is far from over. Our VC Day, Victory Over COVID Day, is still a ways off. But I'm so grateful to each and every one of you who have allowed me to come into your homes each evening. Grateful to our local television stations that broadcast this, to the journalists who ask the questions to educate us all. And I want you to know that as we take new steps to safety, I will continue to share regular updates with you, but not necessarily on a nightly basis. We're going to try a whole bunch of things during this crisis. I was rereading some of Franklin Delano Roosevelt's fireside chats that got us through the Depression, got this country through World War II. And in one of them, he said that he would keep trying things every single day. Some of them would work, some wouldn't, but he would never stop trying and fighting for all of the American people. I make that same promise to you, that we'll keep marching forward, whether it's standing up tests or figuring out ways to trace people, whether it's ensuring that we have financial aid for those hardest hit, or that our seniors don't go hungry. Every single day, we will continue to deliver what you depend on from our city and to look at the ways we can most quickly relieve the suffering while we protect the most people. I'm committed to always be here, to be honest, to share, to work hard, and to be committed to you. Just as you are committed to one another across this city, in your families and your neighborhoods, in your workplaces, and across this marvelous city of angels. While we're learning to live with COVID-19, there isn't a single day that I'm not working on this issue. I know every single day you're working on this issue. And again, I'm here for you, so if you have any questions, continue to call us or send an email. I want to say on a very personal note, I've just been so overwhelmed by emails and letters, notes that people have sent me saying, let's keep going, and thanking me for this communication that we have each night. You shouldn't be thanking me. This is my job. I am thanking you for being the ones who have earned the steps we are taking today and tomorrow. No matter what, we will always give you the data that you need. No matter what, we will not close our business. No matter what, we will present the facts and base our decisions in science and medicine. And we will always keep you informed, whether it's through briefings like this one, or through our social media channels, or through Notify LA. And I want to thank my communications team too, who has stood this up every single night. And Day and Alex and Reed and everybody who clusters with me each evening to make sure that we can do this. And there are other folks I'll be thanking in the days ahead. They have really put this together, and I'm so grateful to them. So we will get through this, my friends, and I will see you soon. So keep staying safe and keep staying healthy. And for now, keep staying home. And to all the mothers out there, a very happy Mother's Day. You taught us what strength and love are all about, and we're sending it back to you. Thank you, and with that, I'll answer questions.
Thank you, and now to the line of Robert Kovacic from NBC. Go ahead.
Hey, Robert, before you ask your question, let me answer last night's question for you. And then I'd love to hear yours. In terms of the Kawasaki syndrome, I did a little bit of research. We do have 3 cases, you may know this already, here in Los Angeles of the 85 nationwide. They're being monitored closely, and it does look like there is a connection because there are antibodies from COVID-19 in these children that are suffering from that. So there is absolutely something happening with some of our young Americans, and here in Los Angeles, 3 of those 85 cases are here. They're at Children's Hospital. But thank you for bringing that up, and I spent a little bit of the last day educating myself and asking for that information, and I wanted to share that with you. Please go ahead with your question. Thanks.
And thank you for addressing it, Mayor. I appreciate that. We're receiving a lot of calls from businesses that are concerned about reopening due to Governor Newsom signing an executive order regarding workers' compensation for employees who return to work and contract COVID-19. And they are concerned, these business owners are telling us, that they are not going to be able to afford opening their doors with this burden now on them.
Yes, I've heard that as well. And of course, we have to figure out a way to make sure that everybody is safe, and somebody who gets COVID-19, especially now as we're opening up other businesses and they're on the front line of this battle, that they obviously have the health care that they need and the space to get well while also not losing their jobs. At the same time, businesses are suffering. So I do hope as the change in law happens and as the legislature comes together, that even though we know the finances are so pinched at the state level and we're all lobbying Washington to help state and local governments, that perhaps they can look at ways that that cost can be shared. I always believe in a balance between not just throwing those costs and regulations on businesses, because if they're not around, there won't be any jobs, but vice versa, having some responsibility because government can't stomach that all. So I have heard that. I think that is a consideration, and I hope Sacramento will look at that closely as the legislature comes back into session shortly. Thank you, Robert.
Thank you, sir.
You bet. Next question, please.
Thank you, and that comes from Claudia Pashuta from KNX News Radio.
Hi, Claudia.
Go ahead.
Good evening.
Hi, I actually just saw Dakota tweeting that you're going to stop doing the daily updates after today. Is that right? How often will we be hearing from you after this?
I'm going to do it kind of as we need to communicate. I may be back this Monday because this coming week is big, or it might be on Tuesday. We still have some decisions this coming week, but I'm not going to be doing it every evening. I looked at FDR. He did these every few months. Obviously, he was in the midst of a depression that lasted years and a war that lasted many years. We all pray that this fight won't. But I've decided that I'll do that as often as possible and continue to communicate with people every single day with the critical messages that they need. So there's no set schedule yet.
Sorry, I didn't mean to interrupt. It's a little hard to hear you on the teleconference. I also wanted to ask for an update on the Project Room Key rooms. How many have been leased? How many have been filled? The LA Times says in a story today that some outreach workers are still having a hard time getting rooms for people. It mentions at least one group renting rooms on its own. And if there are rooms open, I'm wondering why it's difficult for outreach workers to get people into them. Thank you.
It's just difficult work, partially on the side of outreach, which is inherently tough work, and partially oftentimes too because we need to keep getting that supply going. The latest numbers are we have 1,800 operational rooms. We've adding 900 rooms that are coming on this week. So there is always that delay of making sure that the hotels need to staff up, bring people back, protect those spaces, and we've encouraged them to do that as quickly as possible. But there's 900 rooms added this week that are coming online and have come online. So those hotels were agreed upon, and that should make it easier in the coming days. So 1,800 of those are operational. We have 1,672 of those operational rooms 1,799 to be exact, that are filled. So that's a 93% filled rate. There's sometimes more than one guest per room, so it's 1,904 people in them. 962 of those rooms are in the city of Los Angeles. And ask me again on Monday, because I think a bunch of those 900 rooms will be finalized over the weekend. Hotels staffed up. They have to get the kitchens going. They have to order, because food is a part of this as well. So we should probably have some bigger numbers then. But I think it's a reflection of that there's still a need out there. We can't get these fast enough. As I've said, 800 plus that we've looked at, always looking for ones that are affordable too, not just the big ticket ones that might cost much, much more, but house far fewer people. And then in terms of the tier 2 ones, which aren't necessarily Project Room Key, but they're related, there's 423 additional rooms. 60% of those are occupied. We need to keep more of those unoccupied as people get COVID-19. And then domestic violence rooms, we have 223 rooms on top of that. So overall, I'll do quick math, 646 plus 1,800, so about 2,445 rooms total right now. Thanks, Claudia. Next question, please.
Thank you. Now to Dakota Smith from the LA Times. Please
Hey,
go
Dakota.
ahead.
Hi, good evening, Mayor. In terms of the federal aid that Los Angeles and other cities are seeking right now, what is the amount of money that Los Angeles is seeking? I guess broken down, if you know, including the reimbursements for COVID or not including those reimbursements. And then secondly, the city budget that you released outlines revenues that you expect to come in next fiscal year. Now that revenue outlook relies on the stay-at-home order lifting on May 15th. But given that it doesn't appear that life's going to be normal next week, particularly for retail, obviously, are those revenue projections still accurate? And if not, are you going to revise them? Thank you.
Both good questions. The second one first, we never relied on all revenues coming back on May 15th. We always projected there would be a slow recovery. We're taking very conservative estimates, which most economists are saying there's no way it's going to be right back. So we never have, even though May 15th was the advice of the county for the order, we aligned ours with that. We always knew it would be going much longer and that things would open quite slowly. They might have more momentum as we make more progress, but we have never balanced the budget based on the idea that revenues all sail back. I didn't expect tourists to come back probably much, certainly overseas for the rest of this year. We're looking very conservatively at our sales tax. We're looking also at things like our hotel and our parking tax in a conservative manner too, to make sure we can pay for the things that are critical. Our personal protective equipment, our tests, our financial assistance for businesses and for individuals and renters. So that stays the same. But I will say, as I did when I put the budget out, it is the most dynamic budget I've ever been a part of. So ask me every couple weeks and I'll give you an update. Coronavirus relief funds weren't there when we talked about it initially, so that's covering some of the growing expenses that would have resulted in even more cuts, hopefully, because we can backfill those expenses for the things I mentioned, like masks and tests, from those dollars. Second, in terms of the federal aid, I support what the governor said, $1 trillion. And to put that in perspective, states and local government are $3.1 trillion of our economy nationwide. I believe it's 1.8 at the state level and 1.3 trillion at the local level between cities and states. So I don't know exactly what the LA City breakdown would be in there, but we are looking at more cuts. We are looking at tougher days ahead. We are looking at not being able to provide the sort of services that need to respond not only to COVID-19, but to get our economy going again. And the more that we cut, the more the entire economy goes down a sinkhole. Public workers are people too, and they're doing heroic work. And when they get their hours cut, their jobs cut, that means that when they're furloughed, that means there's less money on our main streets for our local businesses, and it has a cumulative effect. So I do support that. I was glad to see Speaker Pelosi today put the line in the sand at $2 trillion for the overall package. I hope half of that will be for states and for local government, and I think it will help us get through the next year and a half. I also think we need to continue that for public transportation as well. It was a good start where we got some, but briefed by Metro, we're looking at a huge gap in the coming 2 years, a slowdown of projects at the exact moment we're going to want to put people back to work. So I hope that there is the relief at the state and local level, and also an infrastructure package that many of us have lobbied for a number of years. Now is the perfect time to accelerate these jobs, rebuild America, rebuild our economy, do it safely, and get us through these times. Thanks, Dakota. Next question, please.
Thank you. Now to Gina Pollack from the LAist and KPCC. Please go ahead.
Hey, Gina.
Hi. I was wondering if you could give us some more details about how social distancing will be monitored at hiking trails this weekend. We're hearing from a lot of people who want to enjoy nature and are anxious to get out right now, but I think a lot of us are also concerned about potential crowding and worried about not being able to follow social distancing rules,
Sure.
especially since a lot of trails are much narrower, 6 feet. So I'm just curious what your thoughts are on that.
Absolutely. You know, this is the toughest one of them all because you have a park like Griffith Park or something like that that's huge and spread out. Many of our trails are in large parks like Elysian Park or Hanson Dam and other areas, or Melviny Park. We need to make sure, first and foremost, that we're the ones taking responsibility because there aren't enough city employees to do this. It's also not our vision to make this like a junior high school dance with people saying you're too close to each other, but we will have out there a monitoring so we can get an overall sense of how many people are there. We'll be able to cut off admissions. By the way, something long that predates COVID-19, that happens in Griffith Park all the time on big holidays and big weekends where it gets simply too crowded for people to come in. So we've done that before. The park rangers will be out there. We'll have Rec and Park staff out there. We're looking at counters on some of the trails so we can actually know how many people are on those trails. Those won't be delivered by this weekend, but hopefully in the next week or two, and they've already been ordered. And we have some very sophisticated plans that we've put together, but they all depend on us. If it looks too crowded, maybe you wait till midweek. Use your judgment. As you're passing people, as I mentioned, give people a heads up from behind. Let them know you're coming. If you see somebody, step to the side. Just use good judgment. And we've gotten much better at this now than 2 months ago where we were kind of confused about this. We know how to wear masks and facial coverings now. We know how to communicate with people to make sure that we're not getting close. But we're going to have Department of Transportation traffic control out there and LAPD helping them. We'll have some mounted units on horseback to let people know. And as always, it's not to come down with a heavy hand. It's the 3 E's, or actually 4. First, we're trying to engineer it so that it can be better for everybody. Second, educate people, as we've done tonight, and your question allows me to go further. Third is encourage. If people are kind of violating those, encourage them when our staff sees people to just do it the right way. And if necessary, we can enforce, and that can be cutting off the admissions or telling people you cannot do this. But I hope that this weekend will be a good experiment. I'm encouraging not everybody to hit the parks together. If you're somebody who doesn't work during the week, who is at home and can, think about going during the week instead of this weekend. Everybody, please don't go out on Sunday for Mother's Day. You shouldn't be going out with your mother if they're over 65 anyway, unless you've been living together, but they shouldn't go out and expose themselves to that sort of danger. So use your judgment. Let's continue to earn this right, and we'll be monitoring it very closely with whatever we can in terms of counts, some of the modeling we already know how to do, and great city staff that are committed to this, and we can always add more if necessary. Thanks, Gina.
Thank you.
Next question.
Thank you, and that comes from Louisa Marshall from NBC4. Please
Hey,
go
Louisa,
ahead.
how are you?
Hi, Mayor. I'm good, thank you.
Good.
My question is regarding testing among the homeless community.
Mm-hmm.
It seems like there are some conflicting numbers about how many homeless people are getting tested.
Mm-hmm.
So can you tell us as of today how many people on Skid Row have been tested for coronavirus? And then can you explain exactly how you're keeping track of how many people in Skid Row are getting tested? Thanks so much.
Let me follow up with you on the methodology because I don't know if I have all the details, but I do have the numbers. So far, we've administered 2,549 tests total to people experiencing homelessness. Of those, 1,539 at Skid Row. Those are actually pretty easy to track because those are the pop-up testing facilities. We have a number at the end of the day. We make that a cumulative number, so I have deep faith in that 1,539. In the county, and remember, people can be experiencing homelessness and they go to clinics that they're used to. They might be outside the city of LA. They might be with providers that go out on the streets in different parts of LA County. There are 223 total people who are experiencing homelessness who have been tested positive for COVID-19. 135 of those are living in shelters. Shelters have been places where there's been tests both in the public-run and private-run shelters. And just 63 of those are in the unsheltered, and 25 are unknown. We're not sure exactly whether they're sheltered or not or coming in and out of shelter. So 25, 49 total, 1539 in Skid Row through the pop-up testing that we've been doing. And let me make sure in that number, I believe there may be some of the public health department testing that's come in, for instance, at the Union Rescue Mission, a couple other places, but the great majority of that has been through the pop-up centers that we've done that people can walk up to. Hope that's helpful. Next question, please.
And that comes from John Rigardi from the Los Angeles Magazine.
Hey,
Please
John.
Go ahead.
Hello, Mayor. You've indicated that some steps forward may be followed by steps back. Assumingly, it's going to take a couple weeks from today to see what impact allowing curbside pickups has on caseload. So what is it that you're going to be looking for? Will a spike of a certain percentage level in new cases, allow you to, move forward or not move backward? Is there a certain level of hospitalization that will be, acceptable in terms of an increase? I'm trying to get an idea of what benchmarks or data you'll be looking at in the future as you decide, again, whether to move forward or backwards.
Absolutely. Thank you for that question. And let me say first, it's my hope that we don't ever have to step backwards. I just want us to be ready. And some of those things may be out of our control because we don't know everything about this virus. Everybody said we could get the flu season back at the same time that this spikes again just by the nature of the virus and the environmental conditions and the time of the year. So we may be doing everything that I ask and the county asks of you, and we still may see cases go up, and we just have to acknowledge sometimes we are going to have to slow it down. There are 3 or 4 main things that I'm looking at, though. One will be as hospital admissions, because that's the earliest indicator of whether our hospital system can be overwhelmed. And that's really the core metric. Can we keep infections below what our hospital capacity is? Because if so, we can give people the very best treatment. We can make sure that some opening up can be going on, and we can live better with COVID-19, as strange as that may sound. Because we know people will get sick, we just don't want them to unnecessarily die as a result of that. Second, we'll be looking at, of course, some of the other metrics, and I think there's 7 of them that we put up on our website. The county is looking at 7 to 11. It can get confusing. I know the states looked at theirs too. But to me, another one of the very important ones is what's the PPE, the personal protective equipment capacity for our medical folks. Do we have at least 3 weeks of that in stock? That's going to be very necessary as well. And also for our businesses, we have to track those to make sure that people can be safe inside those businesses. A third metric that's really important to me is our tracing capacity, making sure that we have the ability within, hopefully 24 hours, but at least 48 hours to trace and contact everybody who's come into contact with a positive case. That's as important as almost anything else. Another one is our testing capacity. As I mentioned, I believe we're at that recommended minimum threshold. We're even above that now. That would be 15,000 tests a day in LA County through the county and city testing centers, as well as our traditional healthcare providers. We're north of 15,000 tests now a day. So that's in a good place and hopefully won't go backwards. But should we lose those tests or run out of swabs and reagents, we might have to slow down too. So those are the main ones. But if you go to coronavirus.lacity.org/safe4LA, at the very bottom of that page, there's 7 boxes. And those are the things that I'm going to be tracking. And obviously, deaths is one of the most important ones too. It's a lagging indicator because it takes a while for people to get infected, for them to get extreme symptoms, be hospitalized, and to die. That is in some ways the last and worst, of course, indicator we have. But if you see deaths ticking up, you know something went wrong a couple weeks ago, or something with the virus is expanding. It might not always be because of our behavior, but even when it's not our behavior, we're going to have to be ready to close things down, ramp things up in terms of testing and tracing. If we can hit all of those, I have confidence that we don't necessarily ever have to go backwards. But loud and clear, I hope everybody is hearing, that's as much on us as it is on public health, our hospitals, and everything else. Thanks, John.
Thank you, Mayor.
Okay. I was told that's the last question. So again, thank you to everybody. Happy Mother's Day to all the moms, including mine. And I'm going to switch to Spanish and say some words. And I will see you early next week. Have a good weekend, everybody. Take this responsibility. Do well. Earn the steps that we are given right now to move forward. And I have confidence in you. I have confidence in LA. And thank you so much, as always, for letting me inside your homes. With that, I'm going to switch to Spanish and say some words en español. Muy buenas tardes, Los Ángeles. Con el Día de las Madres este fin de semana, honramos a las personas quienes nos han enseñado cómo amar, proteger y hacer sacrificios sin condiciones. Y yo quiero decirle a mi mamá, mami, te quiero mucho. Este fin de semana también tomamos los primeros pequeños pasos hacia una nueva realidad. Algunos negocios no esenciales han abierto hoy para ofrecer compras para llevar y mañana podrán visitar a algunas canchas de golf y senderos para caminar. Con cada paso, a total de 14.563. Y hoy supimos del fallecimiento de 51 personas más en el condado, llegando a un total de 1.468 muertes. Y les mandó más sentido pésame a todos quienes han perdido un ser querido en esta lucha. Lo siento mucho. En nuestros hospitales tenemos 1.078 camas disponibles. Entre ellas, 203 están en las unidades de cuidados intensivos y tenemos 1.146 respiradores. Hoy tenemos la capacidad de hacer pruebas a 20,000 personas al día y para el final de hoy habremos hecho pruebas a 250,000 de personas en el condado. Tengo mucho orgullo de todo el trabajo de los bomberos, sitios, los voluntarios que están trabajando para protegernos. Por favor, visita la página coronavirus.lacity.org/testing o llama al 213-978-1028 o al 311 después de las 5. Seguimos nuestro trabajo para tomar acción unidos contra este virus. Por eso estoy anunciando que hemos lanzado esta semana una serie de equipos de trabajo compuestos por líderes en nuestras industrias claves: la fabricación, la producción cinematográfica y la educación secundaria e instituciones culturales. La semana que viene lanzaremos los equipos de trabajo de hoteles, la industria deportiva y los espacios de entretenimiento en vivo. Colaboraremos con ellos para establecer una estructura de pautas para ayudarles a estar protegidos y sobresalir económicamente y cuando deben empezar a abrir de nuevo. Ampliamos nuestro programa para comidas de emergencia para personas mayores para ayudarles a quedarse protegidos en casa. Desde el lunes hemos registrado a 4.774 personas mayores y entregado 33.760 comidas y contratado a 119 personas para prepararlas y 126 taxistas para entregarlas. Este es bueno para nuestros trabajadores, nuestras personas de tercera edad y nuestros restaurantes y compañías aquí en Los Ángeles. Gana, gana, gana. Y esta noche estoy anunciando que estamos colaborando con 15 restaurantes para preparar y proporcionar comidas para más de 1,000 personas mayores en la semana entrante. Y si eres una persona mayor y necesitas que alguien te entregue comidas, no dudes en llamar al 213-263-5226 o visita coronavirus.lacity.org/senior meals para inscribirse. Estoy agradecido a ustedes por permitirme entrar a sus hogares cada noche para ofrecer estas actualizaciones. Y mientras pasamos a otras fases de esta crisis, continuaré a compartir noticias, datos e información con ustedes, aun si no pasa cada noche. Les prometo que trabajaré día y noche por ustedes. Siempre lo he dicho y lo diré otra vez, vamos a salir bien de esto. Entonces, quédense en buena salud, quédense protegidos y quédense en casa. Otra vez, feliz Día de las Madres y fuerza y amor, Los Ángeles. Hasta la próxima semana. Gracias.